Hi, how are you doing? My name is Elaine Bintz. I am a wellness coach. So, I am a holistic wellness practitioner, and my goal today is to share with you about my comprehensive health and wellness program called Get Happy, Get Well. So, this program started several years ago. One of my clients asked me, Elaine, can I just pay you a flat fee for all of your services? And it was a concept I hadn't really touched on before, but it brought up this program. So, the goal of this program is to work in depth with a client, and it's usually performed one on one and help them in all areas of their health and wellness. So, for example, starting with physical activity. So, in addition to using my degree in exercise physiology, I also use my certificate in personal training and help my clients find a tailored program that works specifically for their abilities, their needs, and their fitness levels. So the goal is really to find something or different types of things, depending on what you like, if you like variety, for different physical activities that you can do and sustain for the next 30 to 40 years of your life to find a healthy body and to reverse or prevent future diseases for your life. So also I use my health coaching background. So actually I got my health coaching certificate with the same organization, the American Council of Exercise for Health Coaching. And I actually did this over 10 years after I got my degree in dietetics. So I was utilizing the nutrition concepts, but the health coaching concept actually helped to round out the work I was doing with my clients one-on-one, to help with coaching for behavior modification and to identify some habits or things that my clients maybe were doing that weren't really serving them well. So, in addition to the personal training and the health coaching, I also, after 15 years of practicing as a health coach and personal trainer, I noticed that a lot of people, especially in the commercial gym setting that I was practicing in Illinois, a lot of clients weren't necessarily utilizing the recovery piece of fitness. So, for example, stretching or getting massage therapy or taking enough time to drink water or rest or recover in between sets. So, I decided after about a decade and a half of being in this field, I would return to school to learn more about massage therapy. So, I went back to school and then I earned my massage therapy license, which I am currently licensed in the state of Indiana. And then I also added on Thai massage probably about 7 or 8 years ago. So in addition to having the physical activity and the healthy eating, it's important to focus on the recovery piece. So this comprehensive health and wellness program looks at all sorts of aspects of health and wellness. Some of the other recovery tools that I use are my Yoga Fit. So I am certified in yoga, and the organization I went through is called Yoga Fit. And Yoga Fit does have more of a fitness focus, but it is rooted in Hatha yoga. So in addition to learning different relaxation techniques or recovery techniques, such as deep breathing or meditation or stretching or practicing yoga, I incorporate these into my client sessions. So my educational background is also in education. So I went back for a teaching license, and then I use my teaching education license for all aspects of learning healthy behaviors that are going to help you throughout the rest of your life to make healthy choices, not just for the duration of the time you're working with me, but things that are going to help you down the road, in addition to preventing getting any age-related diseases that you can possibly prevent based on your lifestyle and your genetics. So muscle activation techniques, this one right behind me, is a modality I use as needed if you are having any sort of nervous system problems. Sometimes clients will have problems with the brachial plexus, lifting or gripping or doing something that is really affected by the central nervous system. And of course, if I cannot help my client, I refer them out. So in the Northwest Indiana area, I do have a network of professionals I can refer out for physical therapy, acupuncture, regular regular medical doctor, or if you do have a doctor that's in your insurance plan, neurologist, orthopedic surgeon. So those modalities, I am not a medical doctor. I am a holistic healthcare provider. So what I do is I focus more on diet and exercise, lifestyle, stress management, reducing stress. Those are the modalities that I practice in this program. So typically this program is performed one-on-one. But if you are a client in this program, you can bring in another person. A lot of my clients have brought in family members or someone else who is very supportive for this lifestyle. So one of the keys I've noticed is you can work with me, and it's important that you have another person in your personal life who is going to support you to continue making healthy decisions so that you can sustain and then continue to progress closer and closer to your goals outside of the sessions working with me. So most of these services can be performed remotely. So most of my clients do work with me in person, and they can do a combination of in-person and remote sessions based on what their calendar looks like and what their schedule will allow. But some of the services that cannot be performed remotely would be the massage therapy, partner stretching, and muscle activation techniques. So those services would need to be performed in person. So the structure of the program has changed since I started this program in 2019. So COVID definitely affected how I run this program, and then also depending on what the client needs. So the program has evolved over the past few years. So please reach out to me, call or text if you'd like to have a free consultation about this program, because my availability does change. The best way to reach me is my phone number. It's 708-845-6201. But you can also email me. It's my name, Elaine Bintz @gmail.com. For more information. So the structure of the program, how this works is a client in this program, the cost of the program is $2,000 per month, and that cost covers all of my services. It does not cover the services if I've referred you out to a chiropractor. Those types of services you would have to pay for outside of the cost of the program. But what is included in this program is you have the option to meet with me 5 days a week at the same time of the day, Monday through Friday. So say, for example, if you were committing to the 10 a.m. time slot, so you could work with me 5 days a week, and we would determine how you would use those sessions. So you wouldn't necessarily be doing 5 workouts a week. Sometimes we could spend time nutrition coaching, or if our schedule allows, maybe going to the grocery store or doing something outside of either your home where we're meeting or at my location. We could do yoga workouts, we could do massage therapy, we could do a combination of what you need in order to get you to reaching your goals. So the 5 hours that we're meeting are an option for you. You do not have to attend all 5 sessions every week. So in those sessions, again, can be a combination of in-person meetings or remote. So say you're traveling or you're on vacation and you want to use your time slot, say it's 10 a.m., and you want to have a 30-minute phone conversation. Maybe take a look at some menu items, maybe there's some excursions you want to take or things you want to focus on that you maybe hadn't thought about when you were back home and then you went and traveled. You can use that time to meet with me to have a phone call, or we could have a remote session via like Google Meeting. So this program, I absolutely love it. It is such an in-depth program, but it's so wonderful because every person I've had the opportunity to work with has really had great results. And know that great results doesn't necessarily mean a great weight loss. Sometimes I've had clients working on their relationship with food. Maybe they're working with some mental, emotional decisions that affect their lifestyle. So for example, sometimes with eating, some people have a tendency to make decisions based on how they're feeling emotionally rather than if they have a physiological hunger. So we work through those things, and then as I see that the client, I might not be able to meet their needs, I refer them out. So I can refer out for like a mental health professional if it's something that I cannot help them with in the realm of physical health and wellness. So I am definitely a realist. I like to offer a well-balanced program, which is why I'm a big believer in warming up, definitely doing your workout and then stretching at the end of the workouts, so that you have a nice well-rounded session, especially to the physical activity sessions. And I genuinely believe I was born to do this for a living. So my ideal candidate, my job is to support you. So my ideal candidate is someone who is coachable. So for example, if you come in and you've tried, I hear this from so many clients, they have tried so many different diet programs, or maybe different health clubs or trainers or gyms, and things have not worked. So sometimes it takes looking at the big picture. I do have a very long intake form for this program. So if you've decided you do want to sign up, it's an over a 10-page intake form, which looks at all different areas of your life, whether it's blood work, habits as a child, your health, women's and men's health, reproductive health, surgeries or procedures you've experienced over your lifetime. So it's important that I have a big comprehensive picture, which all the information is exchanged over a HIPAA compliant and secure way of exchanging information. But the goal is to be coachable, and a candidate for this program would be willing to let go of habits that are no longer serving them so that they can get closer to where they want to be. So I genuinely feel like if you're going to take your health to the next level, a comprehensive approach really is important. So working all the time doesn't necessarily give you the results. It's important to have a balance of recovery and rest from all the work that you put into whatever it is you're doing. So please, if you would like to work with me, reach out to me. You can call or text. You can check out my website. It's my name, ElaineBintz.com, for more information. And if you are local to Cherville, you can definitely work with me in person. If you're local enough, depending on how close you are to me, I may be able to travel to you, depending on equipment and if you have space for what we need to do. So thank you again for your time. I appreciate it, and I look forward to hearing from you soon. It's Elaine Bintz, Wellness Coach. Thank you, and have a great day. Bye.